Good evening, India. Good afternoon, Paris. And I'm in North America. Good morning. Welcome to Expressions, a platform which looks at current affairs. It's hosted by the New Indian Express, and the engagement is aimed and designed to look at questions and answers and take the discourse of economy, development, society further. Our guest today is Professor Abhijit Banerjee, who, in that cliched sentence, I can say needs no introduction, but I must introduce him as somebody who has worked on India, on development economics issues, and won the Nobel Prize in 2019 along with Esther Duflo. Welcome to the show, Professor Banerjee.
Thank you.
Along with me in this conversation, to keep it real, is Prabhu Chawla, the editorial director of New Indian Express. Um, we'll try and sort of look at this idea of the post-pandemic India, and our focus is how can we reimagine India or imagine India better? I mean, do we need to do tweaks, band-aids, surgery? What is the way forward? Um, so, welcome to the show, Professor Banerjee. I would like to open this with your perspective on. So we are in an interesting situation. You know, we are in three different continents and speaking to each other using technology, and this is something that we wouldn't have probably imagined some years back. From your standpoint, from Paris, which I believe is under lockdown, how do you think the pandemic is sort of being managed by the rest of the world, and more specifically, particularly because we must address the Indian question, how has India managed the pandemic?
So let me start with the global situation. The global situation is, in some ways, it's more mixed than it looks. If on paper it looks dire, Paris yesterday had France yesterday had the highest number of infections despite being in lockdown. It's the highest ever, 58,000 infections in a day. Mortality rates, however, are much lower than they were, and that might partly explain why people are people are being a bit casual about it. This may there may be a blowback later, which is that maybe right now young people are getting it, and that's going to later affect older people. It's true that mortality is already high here, so it's not, but it's still, the numbers are relative to what happened in March or April, the numbers are relatively low, and that's true all over the world, that the mortality has fallen substantially everywhere relative to the first wave. And partly that's, I think, because of who's getting it. Younger people are getting it, less sick people are getting it. People are being, this is really sick people, and the older people are being more careful. So that's one part of the story. But so but if you, I think the moment is clearly one of being scared. I mean, just the rate at which it has suddenly exploded after being pretty flat for 4 or 5 months, has exploded all over Western Europe. This should be a warning, and this has sort of happened in the U.S. as well. You see this now in Massachusetts, where I mostly live. You see suddenly, after being basically done with the epidemic for about 5 months, it's returned in a scary form. So I think part of the answer is that we are suddenly seeing, say, we are middle of the second wave. The second wave is, in terms of numbers, comparable to the first wave. In terms of mortality, less serious, but we don't know where it's leading. We and
So,
suddenly,
so if I may sort of,
yeah.
I mean, given this context of the second wave, and the picture in India looks slightly better or much better when you look at the mortality rate, the case fatality rates. What the underlying cause of that we don't completely understand, but I guess demographics and probably prior immunities have a role to play in that. So, in given the context of the 100,000 cases in the US, 50,000 cases in France, I mean, India has the curve has completely dipped in the last month. So, how does India look? I mean, what do you make of the India curve?
I really, I and I think many of the epidemiologists I have spoken to are all little baffled. So I will start by admitting I don't think anybody understands what's happening. I think there is because I think there was, especially because there were actually a bunch of kind of large negative shocks. Onam and Ganesh Chaturthi gave it was would have gone down faster if it were not for that, and there might be some Durga Puja effect as well, though that so far looks like it's not there. So there is there were a bunch of sort of things that kicked it up. So given that, especially, it's rather remarkable, and I don't think anybody is confidently saying, I understand what's happening. Now, one possibility is that it's it certainly was geographically quite localized, and it might be that these areas uh, we are close to the relevant measure of herd immunity, which may be that because it seems like some people are much less likely to get it, and that's true everywhere. It seems like there are we don't exactly know why, but it seems like variation both in terms of who is particularly infectious and who gets infected. There are people, spouses, who don't get infected at all despite taking care of their infected spouse. And so there's clearly there is heterogeneity in the response, and we don't know whether that heterogeneity is just accidental, or is it because actually really there it depends on exactly your profile, and given your profile, maybe your herd immunity is actually, if, for example, if 60% of Indians are unlikely to get it, then herd immunity is at 20%, and a lot of places have reached 20%.
So
That's
there has been this discussion within the government and among academics, whether given the data that has come out from the Sero surveys, that probably India is approaching herd immunity level, and whether that is a signal that one should look at to open up the schools, mass transport system. But of course, there is the underlying fear that India was 6 weeks behind the US and Europe in infection, so probably wait out. So, what would be an acceptable level of infection or herd immunity to sort of?
I think the sero surveys are so small. I think one shouldn't do anything based on them. I mean, that's as I wanted to say. One view is that this is what's happening. There is a I think we just don't have the data to say something like that. I was going to just say that that's not necessarily my view. I'm just saying I've heard this view, which is that this is actually there's really two populations, and the people who were vulnerable are now immune, or enough of them immune. That's why it's falling. The other is that actually we have long-term behavior change. People are actually behaving in more reasonable ways. So it's just going to be slow. It's going to be slow but burn, but eventually as people relax more and more, which we see everywhere. Especially I follow West Bengal quite a lot because I'm actually chair of the West Bengal COVID response policy committee.
Oh,
So
that's a very interesting. I mean, that you're geographically distanced, but research wise connected to
yeah, not
Kolkata.
just not so
No,
much
no, no.
research wise, policy wise.
Professor, I will intervene because this is only interesting point. Because Amit Shah was there today
Yeah,
speaking
yeah,
in West Bengal. Now,
yeah.
looking at if you compare West Bengal COVID situation vis-a-vis rest of the country, put country in two parts: one West Bengal and one the national geography. Where do you think how West Bengal is worse or better than rest of India?
Well, I think right now West Bengal certainly has. It's rather remarkable that and this is a bit self-dealing to say this because I'm
Okay,
part
it's a
of
matter
the.
of fact. Sir. It's a matter of fact.
But the fact is that West Bengal has stable rates throughout the Durga Puja period. Now Durga Puja is gone by almost 2 weeks. So
Yeah.
it's clear that if anything happened in Durga Puja, it would have shown up by now.
By now.
So the High Court yesterday actually said exactly that, which is the government's enforcement of its lockdown was during the pujas was first rate or something. They said something, I read it in Bangla, so I can't tell you what they said in English, but they said something good about the government.
But
And
mortality
so,
is still higher than the national average, isn't it?
oh, the mortality is definitely higher than the national average, but
And the
it's
positivity is also higher.
but on the other hand, the Durga Puja had
No impact.
basically no effect. And I mean, I think that given the degree to which West Bengal is extraordinarily crowded and extraordinarily so you might actually it's hard to know whether this what the right standard is. So I wouldn't say that it's a stellar case of preventing it. I wouldn't say it's a stellar case of it's a disastrous case of failure. What I'm observing is simply that the level has been flat for a long time, and in that 1 month when it's about 4,000 infections a day, that Durga Puja was in the middle of that. So
but that's remarkable.
That's a remarkable fact.
Given the DP square, which is the density of population and density of poverty in both, West Bengal has a higher density of population, higher density of poverty than a lot of other developed states, to maintain that flat curve. So that is remarkable, and I wonder whether you had any explanation for it.
Well, I think the government, that's what I said, the High Court actually, it put a kind of a set of restrictions on what could be done under Durga Puja. In fact, the restrictions were draconian and then relaxed a little bit. And I think the government from the beginning, and we were part of that policy process of formulating a very stringent set of rules for what you can and can't do. And the government started by meeting with the people who organize the pujas, offering them, I think, 50,000 rupees per puja for the extra cost of sanitation, etc. So people organizing so that you enter through one way and you leave through another way, all kinds of things like that, so that there was less person-to-person contact. So there was
virtual pujas were held. Virtual pujas were also held.
There was that too, but I think
Prime Minister participated in one of them.
But I think there was still probably 10 lakh people who were in the streets of Kolkata. It was managed quite well, I would say. And that's what the High Court, which had no reason to go out of its way to say it, said that they had done a rather impressive job. So that was the so I think this particular case, I would say the government did put a lot of effort, certainly, into maintaining a certain amount of sanitary and a sanitary environment during the pujas, and that I think is probably consistent with the data. Whether the overall management of it has been, how good, how bad, what's the, as Shankar said, what's the right comparison group? I don't know.
No, I'm coming to that, Professor. I'm baffled by the situation in India, because you have got a state of Kerala where nothing is happening. No social activity, no Durga Puja, nothing is happening.
Onam happened, and Onam increased the infection by 71%.
71% after Onam. Now it is still going up 6,000 cases every day. Now, Delhi, for example, it's opened up a lot of things. But the question I want to raise, economic activity, enhanced economic activity, what they call opening up the economy in terms of services, restaurants, mall, and it happened in West Bengal as well. There was opening of the economy. When enhanced economic activity and the COVID cases, is it an inverse relationship, positive relationship? What kind of relationship it is not? I can't figure out. And Bihar is another example where election is taking place. Thousands of people are getting out without masks. And still the positivity rate is very low. In the number of cases, lower than West Bengal and Delhi.
But I mean, I wouldn't take I would take the positivity rate is depends on who gets.
Let us
Who
do
gets
it.
tested,
Yeah.
who gets tested, and who gets tested. If you know, I could get tested, I'm super careful, I wear a mask all the time, I could get tested 10,000 times and I would still get a positivity rate probably very low, because I'm super careful. So I think positivity rates and actually infection rates are both completely driven by who is the person who's getting tested. So if you essentially test only people who happen to be in cities and who are maybe who are among infected people, you're going to get a high positivity rate. If you happen to test people in rural areas where a lot of places are still really not been touched very much, you'll often get low positivity rate. So I don't want to spend. I think the mortality rates is what's striking. The number we should sort of be puzzled by is the mortality rate, and the mortality rate is uh, I think there is people who claim that if you control for the age of the Indian population, it doesn't look that different from anywhere else. So I
I'm
don't
asking
know.
about economics of COVID, basically, which is related to the economic activity of any country or any city, because that's the
It
question.
should,
It is a choice between lives and livelihoods. That is what it
yeah.
is. And you open up livelihoods, you're likely to
So
get
yeah,
more cases of positivity.
I mean,
So, what is the
let
economic
me sort of
cost of opening up?
I'm
Professor,
not this.
just 1 second, Professor. I mean, that's very interesting perspective there. I mean, in the causality and the consequence thing, because the U.S. economy recorded very good growth this quarter. I mean, today's labor mobilizer report is very positive. Unemployment is dropped from but the case count in U.S. is shot up to 100,000. So
Yeah.
one wonders, I mean, whether there is a correlation, and if anybody has sort of looked at how much of the economy is open and how much of the engagement sort of causes what. And an attendant question is that, is there a way to sort of test the entire population just like they did in Slovakia? But I'll come to that later. But the correlation, whether it's directly proportional, inversely proportional, I mean, how does one look at, because life and livelihood is mentioned in the same sentence, but we don't know the data on it.
Let us look at the cost
I,
benefit analysis of opening up.
I mean, I think there's a bunch of people who are working on this. The problem is that, as we were discussing 10 minutes ago, the basic parameters of this whole thing are not known. So we don't know what the what the interpretation of the what they call an R, the infection. How many people does somebody? This number makes, as far as I can tell, this number itself doesn't make any sense, because it seems like some people infect 30 people and some people infect zero.
Yeah,
A lot of
yeah,
people infect zero. In
yeah.
fact, the biggest, if you plot the number of people that have been infected by a single person, the biggest weight I think is on zero. So even if I'm infected, so it's not that everybody's the same. So all these people are building models of what is happening, but it's very hard to build a model that takes the reality of this disease, because we have so little data on what it does. We're sort of making up things as we go. So my guess is that, I could say things. So we do see, absolutely, there was a huge economic cost. In India, we paid probably the biggest economic cost anywhere in the world for the lockdown the way we did it. So you can easily impose, and there's no magic there. I mean, you shut down all activities, you will get the economy dropping. Uh, Now, what's happening after we have reopened? Is it because we have actually reached a relatively high level of immunity among the people who move? So one possibility is that the people who move, for them, their possibility of getting infected is actually much lower than we expected. They're young. The most of the people who are moving around, the ones who are going and working, they're young. Maybe they don't get infected easily. They don't get sick, so they don't infect others. So they are actually relatively. Uh, so some people had argued a long time ago that, in a sense, we should just, even at the beginning of the pandemic, that you should just let the young people work.
So, Professor, I
And
will ask a question here. Economic cost of lockdown was justified or not?
the economic cost of the lockdown we imposed in India
Yeah.
was clearly not justified. Let me say that. But I think that's a bit of an extreme statement, because the way we did our lockdown is very different from way, for
Why
example,
do you say that? It will not justify. Just explain to the readers and
yeah.
viewers.
So
Yeah.
I think what we did, part of the economic cost was just um, the speed at which we did it. There was no reason to do it the way we did it. That's very clear that we shouldn't have done it right then. Part of the reason why we are fighting now, as I said, I say we meaning as part of this COVID response, the fight we are fighting is everybody saying it's too long, we can't stay locked down, we can't wear masks anymore, we're tired. That's the word, that's what everybody says, and that's what we are fighting. We're in fact discussing how does one get a message through that you may be tired but you might still die. How does one get that message through? But it's really we could have waited on the lockdown for another at least a month, when we would have been much better organized. We could have told people that we'll have a lockdown. If infection rates rise, we'll have a lockdown in a month, because we in the end we had a very high, we didn't escape the original first big wave. We didn't
So,
escape it.
Professor, I can flip the whole thing, because after 7 months and 8 months now, you find the first, because of the lockdown which was imposed in India, you are now seeing that flat curve happening in India, and the Europe and rest of the world. It's not happening because some of them were very relaxed in terms of
No,
imposing lockdown.
it's not true. I think Europe, France, for example, imposed a much stricter lockdown than the US. People were not allowed to go out for more than 1 hour a day. They were really, they was extremely strict. What they did afterwards was what caused the second wave. What they did was they were, in a sense, they felt that they can't continue the lockdown for 6 months. It's just not possible. So they basically let everything open. All the bars were open, all the parties were open, all the restaurants were open. As a result, predictably, it came back. So they, in France, in a sense, did this more or less with the eyes open. They decided they cannot do the lockdown for 8 months. It would be impossible to sustain it. We did it also, in a sense, through the back door. We started opening up. At some point in May, we started opening up, and then we opened more and more. So we went very much like France. We are a bit behind, so we might still get our second uptick, as you were saying, Mr. Chawla. So I'm not. I think that what I'm saying is that I think the one thing we could have done differently is waited for the lockdown. Because there was no reason to lock down when you have 200 people infected. Because we didn't stop it. If we could have stopped
So
it, then that would have been a good argument. But we didn't stop it. We got 1 lakh people infected and all that. So why take the actions, preemptive action? The preemptive action didn't help us. We could have organized the economy better. We could have told people, look, a lockdown is coming, stock up. The lockdown is coming, go home. The lockdown is coming, give people ration cards so that they can get rations in the city. Get people so that they are willing to continue in the economic system and are able to do so. So we could have been a bit more forward looking in the way we implemented it. I think that's the one thing I would say I'm pretty convinced of. I'm not much.
Professor, there was a criticism of the current government because immigration that was happening. Everybody was on the road. They were carrying their children and whatnot.
Yeah.
And about millions of people moved from one state to another.
Yeah.
And the people who moved from one state to another, like Bihar and Odisha and
West
whatnot,
Bengal.
to the West Bengal. Then you see the impact of migration in terms of COVID impact, in terms of number of cases, not proportionate to the number of people who moved from that place. In fact, after those people moved out of Delhi or Bombay, cases in these states have gone up. But cases in places where they moved to, their cases have not gone up. So that
But
criticism
but but
against the government is not, doesn't find any foundation itself.
I don't think, I think that particular criticism that this caused people moving, I would say the government, the actually letting people move was not particularly part of the government's plan. They didn't actually
Correct.
plan that at all. So
Yeah.
I wouldn't give them credit for it. I wouldn't punish them for it. That seems to me to be that they hadn't thought it through. What they did, in fact, But the lockdown itself is something that could have waited, my view. We could have waited 2 weeks, even a whole month, just told people that a lockdown is coming, then the businesses would have stocked up. When I need inputs, I will have it. I will, they could have created protocols so that people, which we did. We eventually, in May, we started opening up, but we were opening up just when the infections were exploding. That was seemed the wrong time to open up. We could have waited to to sort of start the whole thing 1 month later
So
instead of middle of,
yeah,
and that
so
would have been better. That's
Professor,
my,
see,
I'll say that.
I'm
this
loss of using a particular word. I'm just calling it. It's a conflict between biology and economics. Right, the sense people want to live without the fear of getting COVID. Therefore, economic activity has to be given some kind of a break. And there is another option that you must give the economic activity, which gives the people money. They get much more happier life, and they're able to afford medicine as well.
Yeah.
So there has to be balance between biological necessity of living longer and also happier with more money. What do
But
you suggest
sometimes
as a
you
model?
do, sometimes you get, we didn't prevent the explosion of the pandemic. We could, since we didn't do that, we could have waited. My view is that we could have waited. People would actually be more compliant now if the pandemic had started later. The problem now is people are becoming so tired of being compliant that you see this new wave in Delhi. I think this is a result of people just saying, look, we've been locked down for 6 months, 8 months now, and this is too much. We want to celebrate Diwali. We want to, party. I understand. I've been locked down all these months. I'm like stir crazy. I really go stir crazy. I go out, walk in the street for no good reason because I feel like, okay, at least it's going outside. I'm like locked inside the house for ever and ever. So it's not. I feel that even psychologically. So I'm actually, Mr. Chawla, I'm trying to say you are right that there is a trade-off, but I think we picked a kind of a bad point on that trade-off. We could have waited a month. The economy would have been hurt less because things would have been more. People are Indians are very smart. They would have figured out a jugaad solution. They would have, some way of making things move. So the economy would not have collapsed 22 by 24%. Okay, I think, and we would have got the same pandemic. I don't think the pandemic would have been any different because we went to the world. We were world champions for a while. So I don't think that there is any reason to argue that we actually chose safety and we did it so well. We're not like Korea, which killed the pandemic in 3 weeks. We eventually ended up with a huge pandemic. So I'm only saying that I think we
so
could have done things better. Now, let me say one more thing, Mr. Iyer, which is that this is easier to say now that I have understand a bit more what happened. I understand why Mr. Modi did what he did, which is that this was a moment where nobody understood anything. And because every other country was locking down, we locked down too. So I don't want to blame him. I think dealing with a crisis like this, an unprecedented crisis which no one understands even now, I think this is difficult stuff, and I don't blame anybody for not quite getting it right. So I don't want to say that this is shows that the government has it all wrong or anything like that. I just want to say, you asked what's the trade-off, and I was saying sometimes there's no trade-off. You could have waited a month. In retrospect, we know that if we waited a month, nothing terrible would have
We are
happened.
going back to the same. I'm asking another question because now Indian government and everybody we see the figure. Economy is reviving in India faster than anywhere else. That is what we
But
see.
it lost
Demand.
24%. It will revive a lot. That's mechanical almost. You lose 24%. There's so much excess capacity. You're going to
But
revive.
globally,
Revival.
we have lost more than the rest of the world, or we are lost as much
Yes,
as
we
everybody.
we lost much more than any other large economy. We were even, we lost 24%. Nobody even comes close to 10. Any of the large economies of the world, nobody lost 10. We really were like the worst performer for this one quarter. We were the
But
worst performer in big economies in the world.
But now in the fourth quarter, you're seeing that it's picking up faster
Yeah,
than anybody else.
but that's normal, right? You have excess capacity, you'll fill up. I'm good. In fact, you can see me being quoted in the press. Would this be a permanent disaster? I said no. It's going to be a recovery. I was perfectly happy I'm perfectly happy to agree with you that this is a recovery. We predicted the recovery. We expected the recovery. It will happen. But we lost a year's growth.
But
This
you,
year we
as,
will
as,
go
as
back
Modi
to
would say,
zero.
as Modi would say, अच्छे दिन वापस आ गए.
हाँ
Happy
हम
days are
वापस
here again.
नहीं अभी
we
तो
don't know about
हम
that.
अभी भी पीछे हो अभी भी पीछे हूँ कभी तो पहुंच
अच्छे
जाएंगे
दिन
लेकिन
आएंगे.
क्यों नहीं
So this is a good segue to sort of, we know now the causality, causation, and consequence of what we did and how we could have sequenced and timed things better. But with the advantage of the hindsight and reflection that we've done, Professor, I mean, how does India reimagine the future or redesign systems? The Finance Commission has sort of suggested, and some others have written that health be made a fundamental right. To me, that is quite an amazing thing that it has to be stated, because I mean, even by Adam Smith standards, healthcare is permanent and prior obligation of the state, any government. So how do you think, what should it, and you've done enormous work along with Esther, and I think Professor Angus Deaton, who's also a Nobel laureate, on the state of healthcare in India, particularly in the states. And how does India reimagine its healthcare? How does India reimagine the economic way ahead? I mean, we have done a lot of supply side changes, reforms, opening up agriculture markets and stuff. But as Mr. Chawla will jump in and say, that we haven't done much to revive demand, and where is the stimulus, and where are people have money in their hands?
Okay, let me start by answering the second part, which is that Mr. Chawla and I are entirely in this same place on this. I've been saying the same thing, which is that we need to give money in the hands of poor people, and we
I
haven't
call
done
it
it.
vitamin M.
Yes, so I'm with you on that. I've said this also so many times that it's getting a bit tedious to repeat it. But so I won't. Let's go to the healthcare side. And the healthcare side is actually more complicated than you imply, Mr. Iyer, because at some level we already set up a system of what you might call universal healthcare. Okay, that's we a long time ago. We have sub centers within 1 kilometer of almost 95% of the population as a sub center. Um, there's a public health center, PHC, somewhere within 10 kilometers, usually, or less, actually, 6 kilometers, I think, or something. So there is actually, and
No, I agree. I mean, the
start,
three-tier system of
we staffed all those
sub-center,
people.
PHC, and we did that from 1952 or
Yes.
53.
Or
And
after 72 we did a lot, but let
lot.
me just finish my sentence, which is, then I let you. My point is that what is striking, and that's what Angus Esther and I wrote about, is people don't use it. They go to the local quack, and most of healthcare, really the majority of healthcare visits in India, are delivered by people who are not qualified to deliver healthcare. Okay, this is so we have created a system. The system, so instead, when we say, yeah, we should do more, etc., we should stop and think. We have already established a system. People already rejected that system. So we should start as a starting point. We need to understand what we did wrong before. I think it's easy to say the government should invest more in healthcare, but other than multi-specialty hospitals, or basically other than hospitals, very little of the government healthcare system is used. It's excess capacity. It's like you go to a PHC, there is the janitor is there, The doctor is gone because koi nahi aata hai. The nurse is gone, koi nahi aata hai. So and I've done this. This is a lot of my research from 20 years ago. So I've done this many times, and they're empty. No, they're unused. So we have to think through what it means to say we're going to reimagine public health in India. It's not a matter of just injecting more resources, because I think resources have been used. It just hasn't worked.
We might need to rethink on whether it's a coupon based private service provider, something more extended than Ayushman Bharat. But in the immediate next few months, how would, I mean, we will probably have a stimulus, or at least rhetoric of a
I hope
stimulus
so.
in the
I hope
budget,
so.
somewhere towards the budget. So what would your suggestion be for the budget? I mean, how would you design?
I mean, I think this is too long a question for the couple of minutes, but I'll say one thing, which is I think this idea of having a portable ration card is critical, and probably a portable ration card doesn't need to be matched with portable food. It needs to be matched with portable money. I think we built most of the pieces of it. This whole
Aadhaar
the
based thing.
Aadhaar based, and there are lots of things that failed yet in that system. But I think if I had to pick one priority, I would say 1 year of let's make the Aadhaar based bank
DTP.
bank linked Aadhaar based money transfer system work, because if it's a new pandemic, we can send people money. It would really make life easier. There are too many people who had no recourse, and that's tragic. And so I would say let's make an investment. This is a not just giving money, it's also investing in making the system work perfectly. We know the system works pretty imperfectly right now. The Aadhaar based system is the Jharkhand story. You can see that people are taking your Aadhaar number and getting money in
Money.
their in your
Correct.
name. So we have to create a system which has enough checks and balances that it's real. It's not a sort of a pretend protection system. So I do think that we if I had to pick one thing to do, I would say take the next year and let's build an infrastructure that makes the world jealous. We can do it. We are pretty close to doing it. We can do it. Let's focus on that, an infrastructure for making transfers to people, and then we also give them money, because as Mr. Chawla said, there is a demand shortage. But I think building the infrastructure, I would say, I don't believe that there's infinite government capacity. So I think if I had to pick one thing, I would have picked that.
I will turn the sales law, which says that supply creates its own demand. I would say, will demand creates its own supply?
That's Keynes. I would say
Huh,
yes.
yes, because you are Amartya Sen philosophy. You are going to say, but what I'm asking the last question, which is that if you're talking about DTP through the banking system, do you think Indian economy fundamentals are strong enough to have that kind of money to be transferred? Because Modi talking about wealth creators, stimulators is always meant for the supply side economy. And there's nothing which is visible, which people call subsidy, as Shankar here famous frame. The subsidies are meant that people, industries get incentives and they get poor people get subsidies. So this is some kind of a dilemma which has been we have been facing. So do you think fundamentals is quite enough to transfer the money to the people so that we can afford it through what mechanism?
I'm going to say yes. We could have afforded it. The U.S. Printed $3 trillion of just money. They printed money. Europe, the German central bank allowed Europe to print, I think, $1 trillion almost. I don't know,
Yeah,
850
890. Yeah, yeah.
billion or something. This is we did nothing. We
What do you
sat on
suggest?
our
If
hands. We
you
could
were
have
chief, if you were chief
print.
economic advisor to the prime minister, you would have recommended how much money should have been printed by the Reserve Bank of India here.
I think if they printed 3% more of GDP and gave it away, the economy would be in better shape.
What about the rating agencies of the world?
Who gives a damn about the rating agencies? We have never defaulted. Who gives a damn about what they really are? In my view, they are one of the most pestilential influences in the world.
You suggest 3% of the GDP should have been printed extra and distributed to the
Yeah.
people. The GDP that would have made much more difference.
It would have made a huge difference. Everybody would be, the economy would be better. I think there was so much excess capacity.
You think that's the only way? Still, there is a way that can be followed.
I think now it's less true because now the economy is cruising back towards its more full employment. So you print money now, you'll get more inflation. But in the depth of the recession, you could have printed money without much of a cost. In my view.
At this stage, when we are talking, we don't need to print extra money.
I think we probably still do. I think there's still a demand deficit, but the magnitude. You asked me what would I have done. I would have done it in this.
And now,
April.
As we talk, how much extra money should be printed in now?
I
Because
don't
we were
know,
talking
maybe
about
1% of GDP
1%.
or something. I still think it's worth giving people some extra money.
So one of the things that has been always mentioned is that we should build more infrastructure, create more jobs, the old Keynesian way. Since sequence and timing has never been India's best polity, where would you, is this the time to sort of start spending the money on the infrastructure building and creating jobs so that you accelerate the growth, or you would much rather wait for the pandemic to subside by engagement in economic activity? Because we still have the schools are closed, the mass transport system is shut down, face-to-face economy is pretty much closed. So how does one work the timing of that?
Maybe at this point I would wait. I think that if there is a second wave, we would then be caught between. I think it would be better right now. That's why I said right now I would focus on building infrastructure for making transfers possible. So if there's a second lockdown, the lockdown is managed better. I think that this is. So we don't know whether there'll be a second lockdown or not. I absolutely hope and pray that there isn't one, but God knows.
Thank you, Professor, for joining us.
Thank you for having me. That was fun.